Okay, then we shall start now. Okay, I'm the host for the evening. My name is VIRDI. I'm the director for VIRDI Company Limited. For those who do not know me, first of all, welcome to our first webinar. Thanks from the bottom of my heart to all participants for their attendance. Surprisingly, we have received more than 100 registrations. There will be a series of webinars on the same topic. Make sure you register yourself. Invitations will be sent through your contact details too. Okay, so I also appreciate the support of every individual and institutions, including the University of Technology Mauritius, UTM, as well as the Secretary of the Students' Union. By the way, it is the Students' Union of the University of Technology Mauritius. Their support, UTM, as well as the Secretary, Ms. Nidhi, and the President, Mr. Niamalan, and the Manchester Institute of Training Qualifications, Mauritius MITQ, and the Secretary, Ms. Asha Ramtual. I'm really sorry if in case I missed any name. On behalf of VIRDI Company Limited, I express my gratitude to Mrs. Smita Rampat for believing in us and the initiative to volunteer as the speaker upon our request. Thank you very much, Mrs. Smita. Moreover, Mrs. Smita Rampat has an experience of more than 10 years in the field of psychology. Her qualifications consist of an undergraduate degree in psychology from the University of Waterloo, Canada, with the Dean's Honors List and excellent academic standing. Then she Then she pursued her graduate studies to obtain a master's in philosophy for social and developmental psychology from the prestigious University of Cambridge, England. In addition, a PGCHE postgraduate certificate in higher education. Now, if we take a look at her career, she has served in one of the best educational institutions in Mauritius, including MIE, Mauritius Institute of Education, as a resource person and a part-time lecturer in the early childhood education unit, a part-time lecturer as well in UTM, University of Technology Mauritius. Therefore, she consequently became a full-fledged lecturer at the young age, let me highlight that for you, at the young age of 24 at the Middlesex University, Mauritius branch campus. Currently, she is a lecturer at the University of Mauritius, where she has been teaching various psychology modules and engaged in a variety of interdisciplinary research. We are really honored to have Mrs. Smita Rampat as a speaker this evening. I request you to please take over.
Thank you. Thank you, Mr. VIRDI. I sincerely appreciate the invitation and the kind words, and also the belief, your belief in me. And I hope that I am able to deliver as you expect. Well, good evening, ladies and gentlemen. I am really honored to be here, to be talking to you this evening. Like Vikrant said, we have over 100 registration, which is much more than we expected. And I would like to thank you for your time. I know it's dinner time. It's not easy to have a webinar, but I'm really grateful. Without any delay, we'll start the presentation. It might be, we might go slightly over 7:30, but we'll try to finish within time. Okay, here, let me see, just setting up. All right. So today we'll be talking about the promotion of mental health during COVID-19. So what we'll do at first, we'll start with what motivates people's behavior, and then we'll talk about some practical tips that we can do in our day-to-day life. And finally, we'll end with my favorite segment, which is how to build our mental health. Okay, so we'll start. So a lot of you probably know about Maslow's hierarchy of needs. So basically, it is a pyramid of needs that humans have, which basically influence their motivation. So on the lower level, we have a physiological needs, which is the need for food, air, water, clothing, etc. So that's the basic need that a person has, because when we're born, obviously we want to survive. So usually for most of us, we already have those needs covered. The next need that we have is the safety need, which is emotional safety, financial security, personal safety. So those two, the first two, the physiological needs and the safety needs, they form part of our basic needs. The next level is the love and belongingness needs, which is like our relationship. We want to belong. We are a social animal. Mankind is a social animal. So we want intimacy, we want acceptance. The fourth level of need is esteem needs. So this is where we want to be respected, recognized. We build our self-esteem. We want people to look up to us. Then we have the self-actualization and the transcendence needs. So the self-actualization need is basically a need for for the achievement of our unique potential. So if we look at a person, we all have individual qualities, we all have strengths, and actually achieving self-actualization is being the best you can be. So if you're a good runner, it's really kind of developing that skill and making sure you are able to achieve that. If you're very good at mathematics, it's pursuing a career or doing something that will promote that skill that you have. Now, in the original hierarchy, we only had these five. It ended till self-actualization. And then later on, Maslow added the transcendence need, which goes beyond self-actualization. When we have this transcendent need, it's more like we want to help other people develop their potential. So it goes beyond us. It has to do with spirituality. It's more like we do altruistic actions. We help others achieve their potential. Now, the reason I'm talking about that is before COVID-19, a lot of us, we were lucky, for a lot of us, our focus was probably on love and belonging needs, probably on esteem needs, probably on self-actualization. And what happened is with COVID-19, everything went back to the basic needs. So we were struggling for our physiological need. We were struggling to get food, especially during the confinement. We were struggling. There was the fear. What if I'm not able to stock up enough food? What if there's no water? What will happen to our health? We were really afraid for our physical safety, for our emotion, emotionally we didn't feel quite good. And we were scared for our financial security because a lot of people have lost their jobs, unfortunately. So what happened then, from the focus of human on their psychological needs, we actually went back to focusing on our basic needs. And what the impact that change brought on us was that a lot of people throughout the world have had an increase in anxiety disorders. They have had an increase in depression and in substance abuse. And this is particularly true for people who are unemployed and for those who are struggling financially. And the impact that COVID-19 has had on our mental health has been more profound during periods of confinement and during periods where we had COVID-19 related deaths. So without wasting time, because I'm really pressed for time here, we're going to look at practical tips on what you can do at work, at school, and at home to try to manage the COVID-19 situation. But these are, remember, these are only scratching the surface. There's so much more that can be added and should be added, but unfortunately, because of time, we won't be able to go into depth. So I'll briefly go through each of them. So at home, because the world is so unstable outside, it is important that we have stability at home. So it's important that we have a routine at home. Just because we're working from home or studying from home doesn't mean that one day we wake up at 9 o'clock, another day at 3 o'clock in the evening, because we need this consistency. So it's super important that we have a very clear routine and work or study schedule. And when we're working at home or we're studying, it's so easy for us to always be working because we're here. We don't have to waste time in traffic, etc. But we need to set some limits because we cannot always work, or we cannot be dependent on our emails or our cell phones that is always ringing because of work or because of studies. So we need some a definite schedule. So from 8 o'clock to 5 o'clock, I'll be working, and then that's it. It's super important to stay informed about COVID-19, but only using credible sources. There's so many rumors out there, and rumors are not good for our mental health. So let us be informed, but only using reliable sources, and also not all the time. So we need to limit our exposure to social media because it can really take a toll on our mental health if we're always bombarded with information. It's because we are isolated compared to before, it's very important to have our social connections, to build our social connections using technology. Social support is so important. And then the obvious would be to eat healthy, boost your immune system using taking supplements and exercising to get your endorphins going and to be happy, basically. Avoid alcohol and cigarettes and drugs because alcohol is actually a depressant. So a lot of people feel that, okay, they'll take alcohol and then they'll be like super extroverted or they'll feel super happy. But past a certain stage, you actually start to feel depressed and you feel bad about yourself. And that doesn't help to build your mental health. Prioritize personal hygiene, take all precautions, and get adequate sunlight. It's very important that we have sunlight because it makes us feel good. And it also gives us our vitamin D. If you don't want to go outside, you can just look at nature from inside your home and connect with nature. That actually helps calm you down. And we have been given the gift of time with COVID-19. So it's important that you find a distraction and fill the time that you have, the excess time, because usually we used to have time to go to the coffee shop, to go to restaurants, cinema, etc. So we have that time available now. So we need to kind of do something. So practice meditation, yoga, etc. Routine, sleep routine. If you're on medication, please continue taking your medication and consult with your healthcare provider. for any changes in dosages, etc. And do recognize if you have any triggers in your mental health. So if you know that if you watch too much TV, then it's going to make you anxious. So recognize, pay attention to what makes you worry, basically. And if you have the symptoms of COVID-19, of course, don't stay home. You need to take the appropriate actions. So that's for what we can do at home. Now, for those who are working, especially leaders, some tips is we need to share reputable sources and information to our colleagues. In all organizations, there is a COVID-19 response plan, and it is extremely important to also include psychological support initiatives in those response plan. And we need to make our staff or our colleagues aware about how to access those psychological support services. Now, if we make ourselves aware that these are the services that are available, but we kind of judge them for going to use those services, then it's going to be a problem. So we need to promote a stigma-free environment at work so that people feel comfortable enough to actually go and seek help. And we need to make stress reduction and relaxation techniques available. And it's also important to monitor stress or burnout or mental health problems amongst our colleagues or our staff. And of course, if you know that a particular colleague of yours is going to seek help, then of course, full confidentiality. It's not a matter of gossip. You don't need to do that. So let's keep confidentiality. And although COVID-19, it's very difficult at work to, promote people because the organization doesn't have money, it is still super important to reward your staff or to encourage your staff. And as far as possible, it's good to kind of plan development opportunities so that people don't feel demotivated to come to work. And if possible, do encourage the staff to work remotely. I'm looking at my time right now. Okay, so students are actually going back to school next week, and all parents and teachers are super worried. So these are just some tips for teachers. So teachers recognize that you're working with a lot of different people with diverse problems, with diverse backgrounds. So it's important that teachers acknowledge the issues that people are currently having, the students are currently having. And they need to have this empathy and allow students to talk and voice out their concerns. And a lot of our students, a lot of people have actually encountered difficulties due to COVID-19, different types of difficulties. Some have financial difficulties, some have lost their parents, and others have contracted the disease. So it's very important that we recognize those trauma and to try to work with our students on that. Now is the time to build connections amongst students. Although, yes, we need to have the social distancing, but it's really important that we try to get students to engage with each other as far as possible. And simple relaxation technique is really important at school, sorry. You can just teach your students simple breathing exercise. I know for me, whenever I'm stressed, I sigh a lot, and people think, why is she sighing? Is she like upset or something? But that's just my way to regulate my emotions. So I'll go like, and then people will be like super worried, but that's not their fault. It's just me trying to self-regulate. And sometimes, in some cases, learning might have to wait. We can try, we need to support our students as far as possible, even if it means that learning needs to take a step back. Now, parents, I know you're super worried about sending your children to school. It's really important that you inform your children about the situation and also the precautions that they need to take. Tell them what to do and tell them how it's going to be different compared to before. So if before everyone, all students used to be together, now we need social distancing. You need to kind of anticipate the situation in school and prepare your child to adapt to that. You can't just let your child go there and then let the child basically adapt. You need to prepare as far as possible. And also, I'm coming back to that routine. It's super important to have like a regular sleep and wake up time for your child, so that gradually they have this stability and they're able to adapt. Okay, so this is for different places. So now just quickly some tips to reduce COVID-19 stress. Recognize that this is for everyone. We need to recognize that our anxiety is normal. And we need to recognize that there is a limit on what we can change. We cannot change the situation outside, but there are certain things that we can change in ourselves. We can adapt, right? So we don't need to feel powerless or helpless. We don't let fear influence our decisions, and we need to remember we're going to get through this. We're resilient. Everyone will adapt and will manage this situation. Now, the really super exciting part, I'll try to be as quick as possible, how to promote mental health. The first thing, and this you can use actually not only for COVID-19, you can actually use it in your everyday life. It's like a general guide on how to promote your mental health. One is to be optimistic. It's so easy in today's world to be pessimistic, but we always need to look for the silver lining, to look for the positive. We need to kind of view setbacks as a challenge rather than as a threat. And once we are optimistic, we will be able to find something to look forward to. You know, when you are weighed down by worry, when you think, oh my God, the world just sucks, nothing is working well for me, we feel very discouraged and we don't want to do anything. But when we're optimistic, we're like, you know what, this is difficult for me, but I'm going to work through it. I'm going to do something positive, something good will come out of it. It's a challenge for me. I'm testing my strength. I'm testing whatever. I'm really helping. So you help yourself move forward, okay, and face that difficulty. The second thing, which is really important, is you need to ask yourself, who do you want to be known as? And that's really important. A lot of us, we don't know who we are. If you ask someone, who are you? They'll tell you, oh, I work here, or I'm the daughter of this person, or I like this, but they don't know who they are. And it's really important for us to have this introspection to see what's happening in our mind, what are the emotions we're having, and develop our self-identity. So we need to recognize, I want to be known as that good person, or I want to be known as this famous mathematician. I don't know why mathematics keeps coming, but anyways. And you know what? It doesn't have to be a big thing. We all have different goals in our lives. It can be something very simple. I want to be a good mother, or I want to be a good person, or I want to be less angry today. No matter what it is, so long it's something that you can control, that you can do, you can actually work towards it. So once you have this goal, you say, okay, so I will try to be a good person. I will try to control my anger. I will try to pay attention to my health more. So recognize that it's all things that you have control over. So then what you can do, you have this overall long-term goal, And then you take daily steps to work towards that goal. Okay, so you're like, okay, so today I want to be a good person. So what do I do? It's so difficult to be a good person. So what actions can I take today to actually work towards that goal of being that good person? So every day you do this mini step, you have this mini goal. I'll do one good thing today. So a one good thing goes on, you multiply it by several days, several weeks, and without realizing, yay, you have achieved your long-term goal. Okay, and always reward yourself every day for having done something nice, or so for having done something which is contributing towards your long-term goal. And whatever happens, always believe in yourself and know that you are able to do it. The third thing you can do to boost your mental health is to practice mindfulness. So mindfulness is very easy. It's similar to meditation, although you need less tranquility to do mindfulness. So mindfulness, you can be sitting in traffic, you can be sitting in a very noisy room. It's really paying attention to what's happening inside of you. So I can be eating an apple, I just look at the texture, I look at the color, I pay attention to how the apple feels in my hand, and the feeling that I have, the taste. So it's really paying attention to what is happening in the present moment. And with mindfulness, you don't have to block your thoughts. So if you're eating the apple, or you're driving, or you're having a shower. So it's really paying attention to the five senses and all the sensations that are hitting your five senses. And you keep the thoughts coming, you don't block them. And with time, the beauty of mindfulness is with time, you will actually be able to self-regulate your emotions and focus more, and basically be calmer and have more peace. The fourth thing you can do is, if you want to compete with yourself. Okay, it's so easy in today's world to always look outside and be like, oh, he has a BMW, he has a nice car, she has this bungalow, she's making 350,000 rupees a month. So it's so easy to compare. But what you need to do is compete with yourself. So make yourself a better person today than you were yesterday. So be grateful for whatever mistakes you've made, whatever failures you've had, and just recognize that today you are a better person than yesterday, and tomorrow you're going to be an even better person. So every night, it is super important to reflect on one thing that you did well, which is in line with your goal, with your ultimate goal. And every night you will recognize that no matter how depressed you feel, no matter how sad you feel, no matter how crappy you feel, if you're able to pinpoint one good thing you have done today, then it will give you that motivation to add a second thing tomorrow. And so remember, if you have to compete with yourself so that you become a better version of yourself tomorrow. The fifth tip to build your mental health is to be kind. Be kind to yourself. We're so critical of ourselves. It's so easy to, when our friends make a mistake, we're like, oh, don't worry, you'll be fine. Oh, it happens. But when we make this mistake, we're so judgmental. We are so critical. So it's very important that you forgive yourself and you help others. The beauty of helping others is that it makes you feel good about yourself. So we're helping others, but also we're helping ourselves, because when we help others, we know we're doing a good thing. And that actually, it's like stroking yourself on the back, because you feel, oh, I'm such a nice person. So you feel really good. And when you feel really good, obviously your mental health will improve. So always help people. Even if you will get stabbed in the back, that's all right, because you will know that you did the good thing. You did the right thing. People that not recognize it, it's fine. You know that you are worth it. You are making a good thing and you feel good about it, because you won't have any guilt. When you're doing the right action, you won't have any guilt. You will have a self-satisfaction that, you know what, I did the best I could, and that's enough. And that will give you peace. And when you have peace, it's priceless, and it really contributes towards your mental health. Relax and sleep. That's my sixth tip. So we all have worries. Let's take out our worry and put it in this box right there, in the black box, and put the box on the table and go to sleep. Because a lot of times we have difficulty sleeping because we are like overwhelmed by our worries and fears and thoughts, etc. So if we mentally take everything away and put them in the box, and take the box and mentally place it on a desk, we will feel better about going to sleep. Hopefully, if we're lucky enough, someone will take away the box and all our worries will go away. But unfortunately, that doesn't work. Tomorrow we'll wake up and come back to the box and the fears and everything. But it's okay. But at least for the 7 hours that you go to sleep, at least your worries are in the box and you can actually relax. And sleep away your worries. It's really important. Our unconscious mind always works in the background. So if today we have a problem, tomorrow we might have a small mini solution. So really, sleep is extremely important. And if you cannot sleep, what you can do is just try to take a deep breath, and on the count of 8. So in 8 breaths, completely empty your lungs. So like you take a deep breath and then just release your breath in 8 breaths so that you empty your lungs. And if you do it a couple of times, you'll feel super relaxed and you're able to go to sleep. My last piece of advice, I'm 3 minutes over time, but I hope you're enjoying it. My last piece of advice is I learned that when I was studying at Cambridge. So before I went to Cambridge, I was like, you know what? I graduated on the economics and all of that. But when I went to Cambridge, one of the extremely important things that I've learned was by observing visiting professors. So we had a lot of visiting professors and PhD students from like Harvard and Yale and all the very, very good universities. And one thing which was common in all of them was that they were also humble. They didn't go about boasting about their achievements, etc. So one thing I learned there is to be humble, because when you're humble, you don't have to rely on other people for validation. You know your ability, you know your self-worth, you know your value. And the more you believe in yourself, the less you will care about what other people think about you. So just let your actions speak for yourself. And remember, when life gives you lemons, try to make a lemonade and just sit back and relax and enjoy the ride, because life is beautiful. We don't want to waste it. We don't want to worry. We don't want to go on our deathbed and we're like, oh, what did I do with my life? You know? So let's try to really work on ourselves and try to improve our mental health and our situation. And believe me, a lot of these things, a lot of those improvements are in our hands. It's just that we just need to try. So these are the help in Mauritius. These are for mental health counseling. My email, I'm not able to take questions right now, but you have my email on the screen. So please feel free to email me if you have any questions or comments. I will be very happy to reply to you. I have for the presentation I made. And yeah, I would like to thank you very much. And honestly, I've had to go very quickly, and I'm really sorry I could not develop more ideas. Each of those slides could have been one lecture, so it's really hard. But if you can find one thing that you've learned today that you can apply to your everyday life, I will really consider that I've done a pretty good job. So just take one or two things that you've learned today and maximize it, try to apply it to your life, and I'm sure it will really help in your life in building your mental health. So thank you very much. I really hope you have enjoyed the session. And I would like to thank Mr. Vikrant VIRDI for having invited me. And thank you for your attention, because if you aren't there, I would not have been able to do the webinar. So I hope you've learned something, and I wish you a very good night. I think Vikrant. Yes.
So indeed, I believe that everyone has learned something that they can surely implement. Thank you for this wonderful presentation. Of course, personally, I learned new things today, and things that I can develop, especially those that I noted behind the screen is meditate, organize yourself, exercise, even a walk will do, I think. And especially talk about it, talk about mental health. It's important that I believe that you agree with me that you talk about your mental health condition, or if you're suffering from symptoms or whatever we can call it. So talk about it with someone you trust, and as Smita said, don't endorse it to other people. For those people who have got to know that someone is suffering from the issue, do not endorse it. Okay, compete with yourself. A tip that's I believe that you must compete with yourself because you make a better version of out of yourself. Really useful information, and information that will at the end of the day make you a better person, a better individual. Try to implement these tips, spread the awareness. It's important that we spread the awareness. It's high time, because even in workplace, in school, we see on a daily basis that mental health is an issue and a taboo in Mauritius. Unfortunately, we do not have data till now in Mauritius, but statistics from the Mauritius statistics, but hopefully it will become an issue that the authorities will see in the future. Do things to make yourself happy. Always do these things. And eating habits. Hopefully our next webinar will be on eating habits with a popular dietitian. Make sure you register yourself. And I would like to start with Mrs. Smita Rampat once again, that you give something helpful to the participants, as well as the Students' Union of the University of Technology Mauritius, UTM, with the Secretary, Ms. Nidhi, and the President, Mr. Niemalan. Also the Manchester Institute of Training Qualifications, Mauritius, MITQ, and the Secretary, Ms. Asha. And thank you very much for attending, all the attendees. We hope that you learned something, and we'll meet in the next webinar. Thank you very much.
Yes. I want to just add something for those who are here, and for those who would like to share this webinar. We're actually recording this session, so it will be available on Vikrant's website, or as soon as I have it, for those who are friends with me on Facebook, I'll be uploading it and sharing it on Facebook. So please feel free to listen to the webinar again. And if you feel that it will be helpful to some of your friends or family, then please feel free to share it when it's available to me. So Vikrant will send me the video,
yes.
right?
Yeah, sure. Yes, and it will not be
yeah,
copyrighted, by the way.
Yeah, so you can share it as much as possible. And honestly, thank you so much, everyone, for being here this evening. And I wish you a very nice evening and bon appetit for those who haven't eaten. And good night.
Okay, thank you very much, everyone. Thank you.
Thank you.